Hi, it's the nursing professor here. I want to go over 10 concepts related to community health that you should know in order to pass your nursing final. All right, so number one, we're going to talk about the levels of prevention. And you might have remembered this from fundamentals, but there are three levels. The first one is primary. I always remember primary as far as prevention. So you're going to think of things like education, your immunizations, because those are things that really prevent people from getting ill. Number two is considered secondary, and I always associate that with screening. So I use the S with the S. So secondary screenings, and that's going to include things like if you're in the community and you're doing blood pressure screenings or glucose screenings, BMI, all of those things like that. Number three is T for tertiary, and that means treatment. That is once a person has been diagnosed with a particular illness, then they do require treatment. That could also include things like rehab, like a person that had a heart attack, they might go to cardiac rehab, or some sort of support group. All right, so those are your three levels of prevention. Number two is epidemiology basics. Now, I'm going to include number two and number three together because it's all about the data and statistics that you need to have access to in order to determine what's going on in the environment. So number two is epidemiology basics, and number three is going to be communicable diseases and reportables. So you can see the association there. So with both of those, we're looking at the incidence of disease in our community. For example, think about the current state of measles. At one point, measles had been eradicated from the United States, right? But now we've heard of case number one turning into 4 cases to turning into 400 cases. And now I think the latest number is 800 cases. So that says to us that we have a problem. So you're not looking at the individual, you're looking at the spread in the community such that you can start to attack it. Same thing that we did with COVID. Communicable diseases can include things like tuberculosis, HIV, sexually transmitted infections, hepatitis, flu, COVID, any of those types of diseases. And we want to make certain that populations in communities have been educated on them in order to slow down the spread of those types of diseases. When we find that one of those diseases have popped up in our community, then we do what's called contact tracing. And you might have remembered that from COVID as well, where you identify that person and that person tells you where they've been. And usually you're able to pinpoint it down and say, oh, they were at Union Station at 4 o'clock on Saturday. So then all the people who might have been at Union Station at 4 o'clock on Saturday, they could say, oh yeah, I was there too. Oh yeah, I was there too. And then you're able to assess those people to make sure that they don't have signs and symptoms of possibly coming in contact with that person. So that was 2 and 3. So number 4 is going to be the role of the community health nurse. So the community health nurse is going to do all of those things that we just talked about. They're going to do the tracing of communicable diseases. They're going to be an educator in the community. They're going to be the case manager in the community to help a person know where to go. Because just imagine if you were in Union Station at 4 o'clock on Saturday and you came in contact with that person that had measles, you might not know where to go. All right. They're also going to be the patient advocate and collaborator so that they're able to pull all these pieces together, again, to get people to the right place, as well as to make certain that the data is clean and not, messed with, or the integrity of the data is not messed with in order to know where we're going with this communicable disease. All right. I hope that makes sense. Number 5 is disaster preparedness and response. We know more and more we're having all these weather-related disasters. And so when that happens, then nurses have to go out and help to care for those people. So it's not only your emergency response team where you have people who are actually taking care of the environment, but someone has to take care of the people who have been impacted by that. And frequently, that is community health nurses who are going out to make sure that people have adequate supplies, that if they need immunizations, that they are given them in any type of treatment that they might need. Number 6 is dealing with vulnerable populations. So be able to identify a vulnerable population. And so think of those people who are unhoused, or the elderly that might be on a fixed income and don't have enough to make ends meet. The migrant worker, we know migrants are a big deal in our society right now, so we have to be aware of that. Children, small children are very vulnerable, especially those from families who can't afford to have a balanced meal for lunch. And so frequently those students go to school in order to get that one meal a day that is a balanced meal. Individuals with disabilities, you pay attention to those people, because frequently, although we have the American Disability Act, not all the time are these communities geared or designed for people who have disabilities. Just think about it. If you walked outside your house today and you had a walker or a crutch, you say, for example, you had crutches, you broke a leg, then many times you're walking in a community and you'll see like the sidewalks are now not level because of maybe the tree roots have brought them up. And so when you have things like that happen, and you want a person to go and get some exercise, it becomes a barrier to them being able to get exercise. All right. Number 7 is health promotion and education. And so at these events where screenings are done, then we also provide health promotion and education. So that's going to mean giving brochures or pamphlets, maybe even various websites or an app where a person can get further information about the particular topic that is concerned to them. You want to make sure that those brochures are written at a 5th grade level, because if they're not, then many times people, especially people in vulnerable conditions, they may not can read at a 12th grade level. So you want to make certain that the reading is easy and they're able to understand. Number 8 is global health and environmental health, because no man is an island. What happens over in the Congo will eventually make its way over into America. We know that there are not barriers to transmission of illnesses, regardless of how many boundaries we put into place. Again, that's what happened when we had the last pandemic, which was COVID. All right. We also want to ensure that people have clean water. Sanitation, the air quality is acceptable, and the Environmental Protection Agency was put into place in order to monitor that. Lead poisoning, we know that that's a big deal in the development of our children. And so people who live in older homes, they could possibly still have lead paint exposure, which could impact their child. And so we don't have some of these surveillance teams in place, like those that are operated through the EPA, then these things can go for years uncovered. And meanwhile, people could get sick from their environment. And that is something we don't want to have happen. We want public health programs, again, thinking of WIC, which is funding for moms, especially moms in their pregnancy, so that they can get adequate nutrition. Their babies can get adequate nutrition. They might get things like food stamps or some sort of subsidy. Along with that, we want to take a look at Medicare, knowing that Medicare covers those that are over 65, as well as people with disabilities, like your patients that might have end-stage renal disease, or they could have had a disability from anything. So we all pay into Medicare, and so that funding is available, or should be available, for just in case we do need that at one point. Medicaid is a program that's in place based on income. And so if a person has a household income of less than X dollar amounts, it's really based on the state in which you live, then the person might qualify for, again, a certain subsidy. The Affordable Care Act right now is still in operation. We don't know what the future of that is going to look like, but the Affordable Care Act was in place in order to get more and more people insured. And so the policy rates were determined by a person's income. And so people weren't outpriced by having the Affordable Care Act. So, I knew some people who paid $10 a month for the Affordable Care Act health plans. And so those really are great for our communities, because nothing is better than having people insured. When people are insured, there are statistics that suggest that they will go and have health care as opposed to waiting until an emergent situation occurs. And last but not least is number 10, which is the community assessment and program planning. And this is where nurses can be a little bit better at. But what you want to do in that case is you want to be able to do a surveillance of a particular community. As students, you all probably know it as the windshield survey. So you walk around a particular community and you're able to determine what they're actually missing. What you will find frequently are that there are several food deserts that exist. And what a food desert is when there aren't supermarkets within a certain number of miles away, because you really want supermarkets to exist in your community so people can get fresh fruits and vegetables. You don't want just only convenience stores or fast food restaurants, because if that's all that's there, then that is all that people will eat. And we definitely know that it's healthier not to eat processed foods all the time. All right, so we want to be able to identify where there might be a need for a supermarket, where there might be a need to have a walking trail, because frequently when a person comes in to see their provider, then one of the parts of their prescriptions along with medications is diet and exercise. So if you live in a community that has a high rate of crime and has no place to walk, there's no sidewalk or no walking trail, then how is the person supposed to walk? So you want to make sure that you survey that so that you can contribute these things when money is being allocated in these districts, as far as to determine what is needed in particular communities. Now, know also about Healthy People right now, and I guess we're on Healthy People 2030. It has been around probably for 50 years now, and every 10 years they come up with new goals that they want to meet, and you will see consistently there are goals about serving patients that are more vulnerable, trying to level up the playing field. I don't know why it's taken us 50 years to try to get there, but that's a whole nother story. You will see things about managing diabetes and hypertension, which we know are very prevalent in most communities. So know those things. Those are the 10 items that will be most important for your community health final. And I hope that helps, and I'll see you next video. Bye for now.